Okay, so this is an image-based session organized by Maro, and whatever other important and relevant images in pharmacology, I'm going to discuss in this session, guys. So let's begin with the first image. And what is this apparatus known as? And I don't have any doubts that all of you will mark it right. This apparatus is called as PMDI, pressurized metered dose inhaler. So whenever you look at this apparatus, this is the canister, and this canister has one gas, that is HFA, hydroxyfluoroalkyl. So whenever you press this PMDI, this HFA, which is under pressure, comes out by opening of the nozzle. Now while it comes out, what it does along with it, it will bring out certain amount of drug. Now this drug particle size of the particle is between 1 to 5 micrometers. It should not be less than 1 or more than 5. Both are bad. If it is less than 1, if it has become too small, it would just float in the air, right, in your airway. It will not reach into the lungs. If it is more than 5, it would again get stuck in the airway. So the ideal size is 1 to 5 micrometers. So whenever I press a PMDI, the gas comes out with high pressure, brings about whatever drug we have like salbutamol or ICS, and the size is 1 to 5 micrometers. Now, why it is called as pressurized metered dose inhaler? Because the drug is under pressure because of this gas HFA. Metered dose inhaler, every time you press, a specific amount of drug will only come out. Now, for a patient, what is the advice I need to give to a patient while using this apparatus? The most important apparatus is, whenever you press this apparatus, it must coincide with inspiration. Now, this is much easier if my patient is an adult. There is no difficulty. Like, he will train once, twice, thrice, so you will get the hang of it, how to use this apparatus, right? But if I have a kid, a child, then it is very difficult to make them coordinate this. And for that, we have an apparatus called a spacer. So spacer has two benefits. Now you can see the spacer is connected to the PMDI apparatus. Now whenever you press the PMDI, the drug would not directly enter into your oral cavity, rather it will go through spacer. So here, spacer 1, it is useful in kids because if they cannot even coincide with inspiration, still the drug is present in the spacer and then they can inhale it. Second, if I use a spacer with inhalational corticosteroids, that decreases the risk of oral candidiasis, because in this case, the steroid will get deposited more in the spacer and not in the oral cavity. So these are two benefits of spacer, right? Now you can see this is a DPI or dry powder inhaler. Now there are different drugs which can be used as powder as well, but what is the problem with powder? It can produce bronchospasm because it's a powder. So DPI, this is a dry powder inhaler, they can produce bronchospasm. This is one of the drawback of these drugs, right? Here we can see this is a nebulizer. So normally what happens in a nebulizer, the drug that we pour into a nebulizer, it is in liquid form. And once air passes through this liquid, what it does is the liquid gets converted into mist, and with the mask, you'll inhale this. So basically, we use a nebulizer mostly in case of emergency. For example, there is an acute exacerbation of asthma or COPD. What I do, I take liquid, let us say salbutamol or terbutaline, combine it with the ipratropium or steroid, and ask the patient to inhale. So nebulizer is for immediate relief. Alright, this fruit has been asked multiple times, guys, and is not a difficult thing to answer, especially if you're living in India. You would have seen this most in villages. These are plenty. Datura. So Datura has anticholinergic compounds, and whenever there is Datura poisoning, the symptoms of Datura poisoning, beginning from the pupil, there would be mydriasis. So it is anticholinergic poisoning. Mydriasis would be there. Plus, Because there is anticholinergic poisoning, here sweating would be less. In other words, there would be hyperthermia because of that. So mydriasis would be there, hyperthermia would be there. You'll palpate the bladder would be distended. You'll find there is urine retention. So these are the cardinal symptoms you'll find mostly in your MCQs. And Datura poisoning, if it is there, then they ask you what is the drug of choice? A cholinergic drug called as physostigmine. Physostigmine is the drug of choice for Datura poisoning, right? All right, look at this Babaji. What has happened to Babaji? Here there is a pigmentation, which is, you can see the pigmentation as, it is a blue-gray pigmentation, and this blue-gray pigmentation is also known as Celluloderma. So it is seen on the face. Why? Because it is seen usually on the sun exposed area. So blue-gray pigmentation or Celluloderma. Why is it seen? It is seen with amiodarone. Use of amiodarone. Now amiodarone, indeed it is present in the drug, but amiodarone does not give this pigmentation. It is because of amiodarone induced deposition of a pigment called as lipofuscin. So lipofuscin is a pigment that gets deposited and that gives us blue-gray pigmentation. So if this would be seen with amiodarone, what would I advise to the patient? I'll advise the patient to avoid sunlight. Now, how to avoid sunlight? Whenever you go out, just cover up yourself or use an umbrella or apply sunscreen. That is one way of avoiding, not completely, but partially avoiding sunlight. All right, look at this cornea and look at this pattern you can see here. What is this pattern called as? These are deposits in the cornea. These are called as hole-like deposits in cornea. Hole-like deposits, or this is called as cornea verticillata, also known as Vortex Keratopathy. It is also known as Vortex Keratopathy. Now again, which drug causes this? Right, do let me know in the comment box if you know which drug causes this. It is caused by, again, amiodarone. All right. Now, these are accidentally discovered, right? And usually, these are usually asymptomatic. So suppose a patient comes to you on amiodarone with an ophthalmological examination report that there is vortex keratopathy. He is on amiodarone, but his vision is normal. Because these are usually asymptomatic, you will continue drug. Will continue amiodarone, continue the drug at same doses. Continue the drug at same doses, do not change it, right? So this is commonly asked in your exam as well. Now this plant, look at this plant. Which plant is this? The drug that is derived from this plant is frequently asked in your exam. This plant is called as Digitalis lanata, or it is also known as white Foxglove plant. So you would have guessed by now the drug that is derived from this plant is digoxin. Right, so digoxin, in fact, this plant is usually found in the Caucasian regions, right, like Europe. And this plant was usually used for poisoning as well, to kill people. Because, digoxin toxicity can cause ventricular fibrillation and cardiac arrest. That is how the historical use of this plant was there. All right, now look at this. You can see the area of the hand involved is that area where we wear glove. So what is this side effect known as? This side effect is called as purple glove syndrome. Now, purple glove syndrome, guys, the question to you is, which drug can cause purple glove syndrome? The drug is phenytoin, guys. So purple glove syndrome can be caused by phenytoin. And whenever I give IV infusion, normally what happens, if that IV infusion can move into the tissues, that can cause purple discoloration of the hand plus edema. That is purple glove syndrome. That is the reason why we have ditched phenytoin per se, and we have made a more water-soluble formation of phenytoin that is called as phosphenitoin. So by IV route, today, I do not prefer phenytoin. I prefer phosphenytoin by IV route for treatment of status epilepticus. So clinically, you'll not see purple glove syndrome nowadays. All right, what is this plant? So this is a poppy plant, or called as Papaver somniferum, or it is called as poppy plant. Now from this poppy plant, you will derive two opioids, and these two opioids are morphine and codeine. Overall, from one plant, the maximum amount of opioid that I derive is morphine. So these are opioids, means they'll have sedation, analgesia, euphoria, etc. But we have some non-opioids. So chemicals which are non-opioids means they do not have sedation, analgesia, euphoria, etc. These are chemicals like thebaine, papaverine, and noscapine. So non-opioids. So these drugs which are derived, which are opioids, these are the two opioids as we talked about. And because these are the naturally occurring opioids, there is a literary term for that, and these are also known as opiates. So what is an opiate? Opiate is a term used for naturally occurring opioids, and two of them, morphine or codeine, right? All right, now I can look at this guy. I've taught you this when there is an abnormal posture, abnormal posturing, abnormal posturing, right? So here the eyes are not visible. We have covered it, right? Or otherwise, we would have seen uprolling of eyeballs plus torticollis. Now, all of you know this is called as what? Acute dystonia, right? Now, in acute dystonia, what happens is, apart from an abnormal posturing, right, torticollis, uprolling of eyeballs, you can also see a facial expression that is similar in response to severe pain, like this. This is called as what? Facial grimacing. So that is seen in acute dystonia. Now, whenever I have acute dystonia, see, it can be seen with antipsychotics. It can be seen with antipsychotics, and atypical antipsychotics, the maximum risk is with risperidone. So risk, RIS, more risk with risperidone in atypical. Typical antipsychotic, the more risk is with haloperidol. So how to remember this? So risk is more, or high risk is with H for haloperidol. Now once I develop this acute dystonia, all of a sudden, it is possible with antipsychotics. Number two, it is also possible with metoclopramide. It is also possible with metoclopramide. So if you are thinking you will not be a psychiatrist and not deal with acute dystonia, you are wrong, right? So metoclopramide, or this, if they cause it, then what is the drug of choice? The drug of choice are anticholinergics. Now, why anticholinergics are drug of choice? See, the reason why we have acute dystonia, the reason is D2 receptor block. So to treat, if I stimulate D2 or I produce dopaminergic effect, the patient would improve, but then psychosis will worsen here. And that is the reason why I have to find a way out to produce dopaminergic effect without touching dopamine. For that, you have to understand, in the human brain, dopamine and acetylcholine, they have a seesaw relationship. Means, if I increase dopaminergic effect, cholinergic goes down, and vice versa. Here, what is my aim? My aim is to increase the dopaminergic effect, and to do it indirectly, it is possible by decreasing cholinergic effect. That is the reason why anticholinergics are the drug of choice. So which are these anticholinergics? Remember, these are B drugs. B for benzhexol. Benzhexol, which is also known as trihexyphenidyl. B for benztropine, and B for biperidine. 3 B drugs that can be used here. Now, if I don't have access to anticholinergics, I can use an alternative drug, that is promethazine. right? Promethazine. Now, why am I using promethazine? You might have read about promethazine being an antihistaminic drug, but it is an antihistaminic which has maximum anti-muscarinic action as well. So, all of these are MCQs. They do ask you, and this image is important. They'll give an image of acute dystonia. All right. We can see the leg. What is the color of, what is this color known as? Purple. So, there is a purple pigmentation seen on the limb. So, they give you purple pigmentation on the limb, the whole leg. If the whole leg is purple, including the feet, then remember this is something called as livido reticularis. Livido reticularis, which is seen with amantadine. So all of you know amantadine is a drug which is currently used only in Parkinson's. Influenza, we don't use it. So there is another purple called as purple toe syndrome that is seen with warfarin, where the feet is purple. I'll discuss that image as well. Here you can see the entire leg is purple in case of livido reticularis. All right. So what does this site signify? So these are the sites. These are the sites for insulin injection. And the most common site, as you can see, is abdomen. But if you see, we have spared the periumbilical area because there is a high risk of lipodystrophy. We can also inject it in the upper area of the arm, in the lateral area and anterior lateral area of the thigh, plus we can inject it in the upper area of the buttocks, right? But all these areas, they are not that easier, plus they are more painful because the fat layer is lesser. That is why most common site is abdomen. Another reason why abdomen is more common site is because the insulin absorption is fastest from abdomen, plus it is more reliable. Means whatever the units I give, the nearby that much of unit would reach to the blood. That happens with abdomen. All right, guys. When I keep on injecting insulin at one side, you will develop lipodystrophy. So lipodystrophy, this is a case of lipodystrophy. You can see here there is lipohypertrophy and here there is lipoatrophy. So atrophy or hypertrophy together I call as dystrophy. So whenever I inject insulin, there is a risk of lipodystrophy. So what do I ask the patient? To rotate the site of injection. So suppose this is the abdomen, this is the umbilicus. I'll ask the patient to inject insulin away from the umbilicus and then keep on rotating the site of injection. The distance between two sides, it should be minimum of 1 inch, right? So this is what it means, rotate the site of injection. Rotate the site of injection does not mean this, otherwise you'll drill a hole in the abdomen, right? All right. Next. All right, this is a kid, right? A neonate, and you can see something on the scalp. What is this? So scalp has not been completely formed. This is scalp defect and it is a part of cutis aplasia. So cutis aplasia is a teratogenic effect that can be seen with which drug? It can be seen with methimazole. So methimazole can cause scalp defect. This is an MCQ which has been asked. Now what happens with images? They change the word to an image. Tomorrow they'll change this image. They'll ask you which of the following drug has caused this particular side effect in the baby. Methimazole. Methimazole can also cause not only skin formation defect, it can also cause formation defect of other organs like esophageal atresia and corneal atresia can also be seen. All right, what can I see on the back of this patient? So you can see here on this back, there are these lines are called as linear. There are linear streaks of hyperpigmentation. All right, guys, what do I call these linear streaks of hyperpigmentation? This is called as flagellate dermatitis. All right, which drug causes it, guys? Do you know? It is caused by bleomycin. So bleomycin causing flagellate dermatitis has been asked. This image has been asked. What else they can ask you? Flagellate dermatitis that is caused by bleomycin. What is the reason? See, we humans, we have lesser bleomycin hydrolase is an enzyme that metabolizes bleomycin in two places, in the skin as well as lungs. There is a reason why bleomycin is known for producing free radicals. Bleomycin is known for producing free radicals because it is sparsely metabolized in the skin and the lungs. Free radicals are produced more in skin and lungs. More free radicals in the skin, that leads to flagellar dermatitis. More free radicals in the lungs, it leads to pulmonary fibrosis. So anti-cancer drugs, we have discussed that, right? All right, red color palms and soles. Right. So what you see in the image is actually the side effect is the name is the same image. That is, this is called as hand and foot syndrome. So hand and foot syndrome, what happens? There is desquamation of the palms and soles. It's a very painful condition. It is seen with anti-cancer drugs like capecitabine, more than 5-fluorouracil. They can cause hand and foot syndrome. All right. So if I want to prescribe capecitabine or 5-fluorouracil, the most common use of these drugs is in colorectal cancer. And I know that it can be seen. So what would I do to prevent this hand and foot syndrome? I will preload the patient with vitamin D6 or pyridoxine is given for prevention of hand and foot syndrome. All right, there are two things here. They again look purple. I can see this one, which looks pure purple, and this is called as purple toe that is seen with warfarin. So why there is a purple toe with warfarin? It is because of cholesterol embolization. So warfarin can scratch cholesterol from the blood vessels and can cause embolization of the periphery toe, and that is what is called as purple toe syndrome. So this image has been asked. Now here you can see that it is purple. Here you can see there is blue plus some part is purple. Now this that we see here, this is called as ergotism. So ergotism, it is seen with ergotamine. Ergotamine is a very potent vasoconstrictor. And because of potent vasoconstriction, what it can cause is gangrene of organs with end arteries. So feet, it has end arteries. That is the reason why you can see here bluish purple color pigmentation that is seen. So I've given you both these feet at the same place so that you do not get confused in the exam, right? All right. So here you can see hyperpigmentation of palms and sole, increased pigmentation of palms and soles. Right. So if they show you this, don't think it is hand and foot syndrome. Hand and foot syndrome is bright red. Here there is slight pigmentation of palms and sole, and this can be seen with emtricitabine. So emtricitabine can cause hand and feet pigmentation, palms and sole pigmentation that can be seen. It has been asked recently in your exam. All right. Again, there is pigmentation here, but you can see this is the opposite side, right? All right. So what can this be? Anything? So yes, this is on the sun exposed area. It is nothing but it is photosensitivity. So photosensitivity is brown pigmentation on the sun exposed area. What are the common drugs that can cause it? It can be caused by amiodarone. It can be caused with tetracyclines. It can be seen with fluoroquinolones. These are one of the common causes. So when I know that these drugs will cause photosensitivity, what I would ask the patient to avoid sunlight, cover up, apply sunscreen. All right, so you can see here what's happened. There is an edematous lip, edematous tongue, edematous eye, which is not visible. And there is edema of something else which is not visible. There is edema of larynx as well. So guys, this is a case of angioedema. So how to recognize angioedema? There would be edema of the face plus larynx. Now, angioedema that can be seen with the common class of drug is ACE inhibitors, right? I receive a patient of angioedema in the emergency. My aim is to save life of the patient, and I know the patient for a fact will die because of laryngeal edema. So you can see what has been done here, tracheostomy. So tracheostomy is the life-saving maneuver that we have to do if I ever receive a patient of angioedema, which can be seen with ACE inhibitor. All right, and guys, this is the last image for today's session. And you can see this baby, cute baby, but unfortunately, the baby has very small limbs. What is it called as? It is called as Focomelia. That is limb bud defect formations. They have short limbs, and it is seen with thalidomide. It is seen with thalidomide, and that is why thalidomide was banned. So guys, why at Marrow we decided to do this image-based sessions? Because an image speaks thousands of words. And second point is, see, there is a limitation to which you can memorize words. But images, see, there is a movie called as Drishyam. It was first shot in, it is a Malayalam movie, then it was remade in all other languages. And there is one dialogue in Drishyam movie that is, you do not forget something that you see. Right. So there is a reason why we did this image-based sessions, at least in the exam. You would not forget these concepts and answer them. So you can see from image, I'll tell you one thing. Whenever there is a difficult topic that you're not able to wrap your head around in any clinical subject, then what you can do is convert that syndrome or that disease into one image. A raw image, any human being will do, right? Make an image and remember that image. So in the exam, you might forget what are the words in the syndrome, but you would remember that image. You will keep on watching it time and again. So guys, that's all from my part, from Pharmacology. All the best to all of you guys for your upcoming exams. Take care. Bye-bye.